Hello, my name's Adrian Richards. I'm a plastic and cosmetic surgeon and the surgical director of Aurora Clinics based here in the United Kingdom. In this video I'm going to be continuing our theme of breast reduction videos. I previously talked about who's suitable and the techniques that can be used, and now I'm going to talk a little bit about what's actually involved, the nitty-gritty, so to speak. So the first thing is you normally have a pre-operative assessment about a week before surgery, where they'll get you in, do a heart tracing, blood test, and just make sure you're generally fit and healthy. Then a week later you have your operation, and you'll come in normally on the day of surgery. If it's me doing the surgery, I'll come and see you, we'll take photos, and I'll draw on your breasts. So it's important that that's done with you sitting upright, because the markings change slightly as you lie down. When you're having an operation, you'll be lying down. So I'll spend about 10 minutes doing the markings, and that's really marking where the nipple's going to go to and which bit of tissue I'm going to remove, and I'll answer any questions you've got at that time, and we can go through any issues you've got. Then the anaesthetist will come and see you, and I've worked with the same anaesthetist for a long time, and she's a lady, and she will talk to you about her aspect of the anaesthesia, and in particular if she's going to numb the chest area up with local anaesthetic. They sometimes use a technique called intrapleural blocks, which essentially makes the whole area pain-free for about 12 hours following surgery and reduces the amount of anaesthetic drugs they give you, so you're much less likely to be sick after the operation. So then you go down to the operating theatre. You won't know much about it for a couple of hours. The operation takes a couple of hours, but you probably won't be aware of much. You'll be sleepy for the first half hour you come out of the operating theatre. When you come out of the operating theatre, you have a bra on, which we fit in the theatre, and you have brown tape on the incisions, so just brown micropore tape over the absorbable stitches. And I normally don't use a drain. Some surgeons use drains. I prefer not to, because they're painful and a source of infection. And then you'll be hopefully pretty pain-free for the first, in that day. We give you painkillers if you need them. You shouldn't really be sick, and then we encourage you to eat and drink, really quite soon after the operation. Mobilise, go to the loo on the day of surgery, because that sort of keeps the blood flow going to your legs. Okay, so that's really the day of surgery. In the next video I'll talk about the subsequent days following surgery. Thank you.